Good evening, everyone. My name is Cory Nettles, and I'm the chair of the Medical College of Wisconsin Board of Directors. It's my great honor and pleasure to welcome you all here this evening to our town hall meeting. Obviously, these are absolutely unprecedented times, and I hope we at MCW hope that you and your family and loved ones are staying safe during this time of crisis. At MCW, we are trying very hard to be a trusted source of truth and of information as we're serving our entire community. We're certainly leaning into that role and are trying to be as ubiquitous as we can and making sure that we get information out to every corner in our community to address the concerns and the fears and the anxiety that we know people are feeling and are experiencing out there. It's my pleasure in that regard to have Dr. John Raymond and Dr. Ian Martin, both from MCW, here to present at our town hall this evening. Dr. Raymond in particular, I will take some personal liberty and say has been just working, it seems, around the clock himself and with the rest of his team to really make sure that MCW is making itself fully available to all members of our community to provide us the information that we need to stay safe. We hope that throughout the presentation, if you have questions, there's a button there available to you. Certainly feel free to send your questions in. And after presentations for Dr. Raymond and Dr. Martin, we'll look forward to taking those questions. They hope to keep their presentations reasonably brief so they can respond to as many questions as you have. So thank you again for joining us, and thank you, Drs. Raymond and Dr. Martin, for making yourselves available this evening.
Thanks for having us.
Thank you, and thanks, Cory, for your leadership. We're fortunate to have you here in Milwaukee. And we wish to acknowledge all of the many partners that are on the call, the Milwaukee Health Department, city and county leaders, our region's health system leaders, and most importantly, you, the community leaders who are working hard to improve your neighborhoods and Milwaukee and to build a better future for all of our children. And we want to thank you for joining us tonight and for being advocates to help keep us all safe and in good hands. As Cory said, these are very difficult times for our country, the world, and our city. And I want to assure you that our doctors, healthcare professionals, and scientists at MCW and really throughout the region are doing everything that we can to keep our people informed. But also we want to make sure that we hear your thoughts and get feedback from you on what we can do better. And that's part of why we're all here tonight. As Cory said, after we briefly share information, we really want to open it up for your questions, and we'll do our very best to answer. Much of what I'm going to say is brief and straightforward, and you probably know it already, but I think it'll help for us to have a common base of knowledge from which to have questions. So first and foremost, coronavirus is serious. Despite what you may have heard from anyone else, it's not the flu. It's a very serious disease, and it can kill people. And it can infect anybody, regardless of who you are, where you live, work or play, how old you are, what you do for a living, and what your pre-existing health is. And it spreads the same way for everybody, largely through contact, maybe somewhat through coughing and sneezing, but really it's through the physical contact from hands to face. This virus spreads very easily and it is deadly. It's at least 10 and probably more like 50 times more deadly than the flu. Simply being around other people greatly increases your chance of getting the virus. The virus spreads through touch. It enters our bodies through our eyes, nose, and mouth, from our hands, or from the air if people have sneezed or coughed around us. We don't know why it's spreading more rapidly on the north side and the south side communities, and we're deeply troubled by that. And that's part of why we want to continue to share what information that we have with you and then hear from you about what you're seeing in your community. What we do know is that a few simple things do help destroy the virus, and they can be effective in slowing down the spread in our community. To stay safe, we need people to stay home as much as possible and to stay away from other people outside your home, unless you're doing essential work or conducting business like getting groceries and medications. You can destroy the virus by washing your hands with soap and water and by cleaning surfaces that you touch with soap and water or bleach. If you must be in a public place, we strongly recommend that you maintain a safe distance of about 6 feet from others as much as possible. And that would mean even if you're in the grocery store, it's probably okay if you pass by somebody, but try not to touch them or spend a lot of time in their personal space bubble. Now, if people in your home are sick, Do your best to try to keep separate dishes, utensils, clothing, and spaces within the house as much as possible. And we fully recognize that for many people in our community, that type of social distancing, both outside and inside the home, is very difficult and perhaps impossible. We do want to make sure that everyone knows that the virus can hang out in the air for a few hours. It probably will remain in the air longer inside than outside, and there is a possibility that it could be spread through the air. As a scientist, I'll tell you that there's not a lot of evidence that handmade masks or bandanas will stop the virus. It's most important simply to keep distance between people. But I will say that there are many people who think later this week or next week, our Centers for Disease Control and Prevention and other experts might actually begin to recommend wearing masks in public. So I just ask you to stay tuned for more information. And with that, it's my honor to hand the floor over to Dr. Martin.
Thanks, President Raymond. So I think one really important thing for our listeners and our viewers to know are the signs of infection so that they can be a part of helping to stop the spread. So most commonly, patients who are affected by coronavirus present with fever, pretty high fever in fact, cough, and shortness of breath. But a really important thing to know is that many times patients don't know they're sick for up to, or carrying the virus rather, for up to a week's time. And so that really makes important the need for social distancing, to stay 6 feet apart if at all possible from other folks. And as President Raymond says, to stay at home if at all possible. But also good hygiene is essential to breaking the chain of transmission. So frequent and thorough washing of the hands, keeping your hands away from your mouth, your nose, and your eyes as well. So if you do become worried that you're infected by coronavirus, we ask you to call your primary care physician first, or even 211 for immediate help. One thing that's really important is not to go directly to the emergency department before first speaking to a primary care physician or a triage nurse who can give you guidance on where the best place to go is for care. Unfortunately, while we'd like to test everyone for this virus, there is a limited supply. The ingredients required to perform the test are in shortage. And so hospitals and health departments are left to make some difficult decisions about in what order do we test folks. And right now, our first priority is testing folks who are going to be admitted to the hospital or healthcare workers who may have had an exposure and have symptoms. Secondly, older individuals, particularly those who have other underlying conditions like heart disease or respiratory disease. Thirdly, younger folks who may otherwise be healthy, who have symptoms of coronavirus. And lastly, folks who are asymptomatic. We are doing our best to get as many tests as quickly as possible. I invite you to visit our website at MCW, specifically covid19.mcw.edu for the latest information around these. The Milwaukee County Health Department as well as the CDC are great sources of information as well. So with that, I think we'll take some questions from our audience.
Before we do that, Dr. Raymond and Dr. Martin, I was neglectful in giving you both your appropriate introductions. For our audience, I should mention that Dr. Raymond is the president and the CEO of the Medical College of Wisconsin, and Dr. Martin is the head of our emergency medicine division. So thank you both.
Thank you.
Gentlemen, this is Eric Johnson, your technician, and I'm watching for questions coming in. Only one question so far from the audience, and they were wondering why it was in Spanish when we first came in. Just to address that briefly, I believe that some of these telecom systems are experiencing some glitches due to the extreme amount of demand that is being demanded of them right now. So apologies for the Spanish thing. That wasn't intentional. I think it was a glitch. So everybody submit your questions in the question pane, and here we go. We've got a few coming in. So this one's from Nicotris Perkins. If you need to be out of the house for an extended period of time around many people, even with practicing cleanliness and social distancing, how long should you be self-quarantined from those you live with after you return home?
That's a tough question. I'll start, and maybe Dr. Martin can give advice too. There's really no recommendation that you self-quarantine for incidental public exposure to other people, unless they're sick or you were in their personal space bubble for at least 15 minutes and you're concerned that they may have an infection. What we really don't want to do is have people socially isolate themselves from their loved ones within their own home. And so this is it's a tough balancing act to make sure that we do the right things in the community when we're out there, but that we still stay connected to our family and loved ones in our own home. Ian, did you want to add to that?
I think that's perfect. So just by doing your usual, just say grocery shopping, as long as the person doesn't seem to be sick, there's no specific recommendation to quarantine yourself when you get back home.
Thank you. Suzanne asks, what is the evidence that it may be airborne?
I'll start. Like other coronaviruses that may cause the common cold, we know that one of the ways that it's spread is through what are called respiratory droplets. If you breathe or cough or sneeze, you have some mucus or saliva that can carry the viruses, and it becomes aerosolized into droplets that can persist in the air. They can also fall on surfaces, onto your hands, and we believe that when those droplets touch your hands or a surface that your hands touch, that is probably the most common way of spreading the virus.
And the virus can live for several hours on those surfaces. So that's why it's important, again, good hygiene, wiping surfaces down frequently is a really important way of preventing transmission of the virus.
I'm going to advance to the next slide because there's some good information on here on steps to take to contain and destroy it. And I'll read the next question for you from Aaron. Will we ever be able to test all of our employees?
We sure hope so. I think one of the problems for all of us that we're really struggling with, well, there are really two. First is that you can be contagious and not have any symptoms for a week, which means you can feel fine and spread the germs. And second, we just don't have tests. If we had the testing, the first problem where you being able to spread it while you're feeling okay wouldn't be so much of a problem. And I think our government and the world are actually struggling with trying to find ways to get those tests out to the front line. I think we're up to about 2,000 tests a day in Wisconsin, but that's spread out over the whole state. And we're urgently doing our very best to increase that capacity. And we know that people very much want to be able to have testing on demand. And we hope that'll happen, but it's very unlikely to happen in the next few weeks.
Sure.
There's a question from Melissa. Are N95 masks recommended in the inpatient setting versus surgical masks?
Dr. Martin?
Yeah, I'll take that. So our practice right now in the CDC recommendations is that really the advanced masks like the N95 or things like PAPRs, which are hooded masks, really should only be used in the highest risk exposure situations. And so those are invasive procedures that cause what we call aerosolization, or where the virus is in small droplets that float in the air. So absent those conditions, a regular surgical mask should suffice.
Very good. Martha asks, are we getting close to a vaccine?
Martha, not really. A lot of press out there about people trying to make vaccines. Finding a vaccine that you think will work is easy, but testing it in people and establishing that it's effective and then manufacturing enough that you can distribute takes about a year to 18 months, even on the fast track. And I don't think there's really any way that we're going to be able to have a vaccine any sooner than that.
Madeline asks, what should folks do if they don't have a primary care provider? Call 211?
I'm going to let Dr. Martin handle that since he runs our emergency department.
Yes, that would be our recommendation. If patients are not connected with the primary care physician, then certainly calling 211 for some guidance about drive-up testing centers, or whether it would be appropriate at that point to go to the emergency department.
Carrie asks, I've heard conflicting information about when this will peak in our area. Is there any data to suggest when that peak may occur in Wisconsin?
We've heard conflicting data too. There's a lot of confusion, and part of the problem is the only example so far where there's been the virus that's gone through community and there's been some resolution of a pretty significant spike is in China. And we're not sure whether we're getting good information from there. Italy now, which was the next community to have a real problem with it, has been really struggling with this for over a month, and they're not out of it. So what I can say is optimistically, there are models that suggest that if everybody cooperates with this social and physical distancing, we here in Wisconsin might have our peak near the end of April or early May. That's optimistic though. So what we're trying to do is say, look, everybody's got to help. Our employers, community leaders, individuals, do everything that you can to try to help keep the spread down.
May asks, in Europe, they are recommending that clothes be taken off immediately after entering the home and bleaching shoes or leaving them outside. Have you heard of any of these recommendations here?
Dr. Martin?
So the short answer is no, not routinely. We do know that some folks who are on the front lines providing care in a hospital setting have adopted practices of making sure not to wear home clothes into the clinical environment and those same clothes back into the home environment. But in terms of folks who are not in the clinical environment, no, I don't know that to be a recommendation.
Question from Ankankshaya. How long should we anticipate the lab hibernation to continue?
Ankankshaya must be a scientist. So thank you. We have hibernated most of our labs at MCW. Those would be the research labs that aren't doing essential work on the coronavirus. That's a great question. I think that we're going to follow whatever the government tells us about guidelines for reopening business. And we think that's the most important thing we can do. We're hoping, again, that if the optimistic projections that this may peak at the end of April are true, that we might be able to start coming out of this in early May. But again, I think those are optimistic, and I'm not sure that we can unhibernate our labs before then.
Karen asks, 2 weeks ago, I was sent to Frederick ER with COVID-like symptoms and tested positive for influenza A, so did not get tested for COVID-19. I do have asthma. Do you have any idea when the antibody tests will be available? Could I possibly have had influenza A and COVID?
I can take that question. It's unlikely, but not impossible. We do know about 6% of the time. So 6 out of 100 patients could have both influenza and this COVID-19. So chances are influenza is probably the cause for your symptoms, but it's not impossible that you also have coronavirus.
For the second part of the question, there are antibody kits that are coming on the market. One of the problems with the kits is we really don't know how good they are, and there may be some cross-reactivity with cold viruses, and that needs to be established. And as you might expect, everybody's trying to rush to get these out there, and we just don't know enough about the testing. Like you, we certainly hope that there will be validated antibody tests available, hopefully within months, where we can tell people, yes, you did have the coronavirus infection, and now you have recuperated from that and can go back to work. But we're not there yet.
Doctors, I'm going to go ahead and advance to the next slide, which has some really good advice on what to do if you're feeling sick. And while people read that, I'll read you the next question from Jackie. Are we seeing promising results with hydroxychloroquine and azithromycin for patients at Frederick?
Do you want me to take that one?
Yeah, why don't you go ahead and take it? That's such a tough question.
Yeah, so I think one really important point to make before I even attempt to answer the question is that there are no definitively proven specific treatments for COVID-19. The only treatment that we have that we know works is supportive care. There are, as the question suggests, some experimental things that are used for other conditions like malaria or like some rheumatologic conditions that may have some benefit in sicker patients who have COVID-19. So we do have a protocol in our health system such that patients who are admitted to the hospital are usually administered hydroxychloroquine as part of their therapy. But again, the data is very limited, and so I'll leave it at that.
We got a question from Kevin. Given the amount of time it took before the virus was identified, how plausible is it that some of us who were flying regularly within the US between January 1 and March 1 have already been exposed?
It's plausible, especially if you were in New York or Seattle, I would say, and maybe even California, but really anywhere.
Good question.
Question from Lauren. How can we, the community, help you all figure out why it's more prevalent in Black and brown communities? Seems like it's hard to fix an issue that we can't name.
Dr. Raymond, you want to take that one first?
That's a tough question. It's part of why we're trying to talk with everybody tonight. We don't know if there's a lack of information, if people have the information but they don't believe it. If there are social issues where people simply can't protect themselves by nature of the work they do or where they live, or if they don't have a home, we really don't know. And we're looking to you to help us.
Next question is from Jennifer, and this actually I've skipped over a couple of the questions about peaking, and this kind of renews that. So I think people continue to ask, do we have a sense as to how long this virus will continue to spread in our Milwaukee community or the rest of Wisconsin?
I would just say that we need to be prepared for this to go through May. We'll hope that it will peak in late April and that it'll start to be controlled across the country, especially if some of the testing can be rolled out by then. But I think all of us need to be prepared for this to go through May. What do you think, Ian?
I was just on in another meeting before this, and that's sort of the people much smarter than myself. They think that the peak won't be for at least 2 to 4 weeks, and that we'll be well into May here in Wisconsin.
I have a question from Danielle. I have read that once you recover from the virus, you are then immune. Is this true or accurate, or do we know?
We don't know. We're hoping, and I think most people are believing that it will be true. But you know, there are some early reports of people that were sick, got better, and then became sick again. What we don't know is how good the test was to establish that they had actually cleared the virus. So we really don't know. And without getting too technical, I think I have to be technical because I'm a scientist. What we know is this virus doesn't mutate very quickly. And unlike the flu, which every single year there are many new strains that come up, so your immunity from the previous vaccine or infection isn't good. Because this mutates slowly, it's very likely that people will have an immunity that will last at least through this year. But we don't know that for sure.
Michael
By the way,
asked,
I just wanted to say, you're asking all the same questions that the scientists are asking. So it's a good, I think it's good when we're all asking the same questions.
Absolutely.
a question from Michael. Does UV light kill the virus?
Yeah,
Maybe.
yes, we believe so. And in fact, you've heard probably a lot in the media about the personal protective equipment and shortages in other parts of the country. We've had the good fortune so far here in Wisconsin not to be faced with that, but we're not taking anything for granted and are looking at ways that we can make our personal protective equipment last longer, including treating it with UV light.
So Ian, if I could just answer that from a different perspective. You answered it from our perspective where we have access to strong UV light of the right wavelength to kill the virus. We're not sure that being out in the sunlight where there's UV light is going to kill the virus. We just don't know. And again, unless you have a UV light in your home that you can use or in the workplace, I wouldn't count on the sun for killing the virus.
Good point.
A question from Jackie. Are we developing any plans for DNR status for patients with a very grim prognosis if we run out of vents, et cetera?
Well, we're doing everything we can to not be in that situation. And we'll certainly do our best to use the usual methods that we have of talking to the patient and their family about what their wishes are. But we do know that at least in Italy that they're having to ration ventilators, and they've done everything they can to split them and use them for 2 to 4 people, but they are having to make some hard choices. I'm not aware that they're doing that anywhere else right now, but Ian, you would have a closer familiarity with what people are having to do in New York.
So the short answer is I have had conversations with folks elsewhere in the country that have had to amend their policies around futility and DNR from the usual 2-physician standard to a single physician attending physician standard. So again, we hope to not ever be in that position, but there are some initial conversations around those sort of policies to give clinicians some real-time guidance around those difficult choices.
What I would say is we're lucky at MCW that we have a bioethics department with some really good people that work closely with the community, with our healthcare providers and with our hospital system partners to try to make sure that when we have these conversations that we're thinking about it from an ethical perspective.
That same Jackie had a couple of other really more medical questions that I'll go ahead and ask now. The first one was, how many weeks of PPE does Froedtert have for staff in a projected COVID influx? And then a second question was, is Froedtert seeing false negatives come back needing hospitalization?
President Raymond, you want to tackle that one first?
I don't work for Froedtert, so let me just make sure everyone knows that the hospital is a separate organization that we work with. I know that they've done everything they can to secure their supply chain. They're learning from other health systems in Seattle and New York about safe ways to preserve your personal protective equipment, and they're doing a pretty good job. But you know, that's a question that our faculty and staff and other providers ask every single day, and all I can say is we're doing our best. About people that tested negative, could you repeat that part of the question again?
Sure, let me get back to it here, I'm sorry. Is Froedtert seeing false negatives come back needing hospitalization?
I'm not aware of any, are you, Ian?
Not off the top of my head, but it does bear mentioning that we know that the test is not the best test. In fact, about 30% of the time, the test is inaccurate. So it is certainly possible that someone who actually has the virus will test negative. And that's why the CDC makes recommendations about repeat tests for cure, but also as part of diagnosis if there's a high clinical suspicion.
Question from Erica. Can you talk more about the more mild symptoms most people have?
So this has been very interesting. I in my opening remarks spoke about some of the more common ones that we see, which again are cough, shortness of breath, and fever. But the reality is, as is the case in many viral illnesses, there's a whole array of symptoms that we've seen in patients. We've had people talk about changes in their taste. That seems to be an emerging common symptom, which we wouldn't ordinarily think of as suggesting that one is infected with a virus. Diarrhea is one that we've seen more and more over time. Body aches like the flu is another one. But the really the ones that are most common, particularly the patients who go on to have more severe disease, seem to be associated with the respiratory tract, so the trouble breathing, the high fevers, and the cough.
Question from Madeline. If after going through a nurse or your PCP via phone and they recommend you get a test, what should folks expect when they go in to get a test? Does this vary based off of the hospital or clinic?
Yes. So for example, in the Freighted Health system, we do have several drive-up testing centers around the region that you could be directed to. You need to have a connection to the freight. You need to be already a patient of Freighted Health to go to those particular centers. And I think the other important thing, and I sort of mentioned this in my opening remarks as well, I think, again, while we don't want patients going immediately to the emergency department, these many emergency departments are not routinely, not because they don't want to, but because they literally don't have enough tests to test any patient who shows up to the emergency department. So most likely, if you were to go to an emergency department and had very mild symptoms, a reassuring physical examination, normal vital signs, you would probably not receive the test in the emergency department.
Question from Jerry. If, as you suggest, the CDC changes its guidelines for wearing masks for people who go out in public, do you suggest using the homemade masks in order to not put additional constraints on supplies for our healthcare workers?
Thanks. That's a great question, and it really comes down to personal choice. I would say if it were me, I would just use the mask that I have. If you've got a huge stock of masks, you might want to think about sharing those, but I'd wear the ones that you have. And again, there's a growing belief that anything's better than nothing, and even some of the homemade cloth masks may confer some small amount of protection that, again, is better than nothing. Do you agree, Ian?
Yeah, I do.
Dr. Kenneth Harris Jr. asks, what should be done for first responders who come into contact with people who are sick needing assistance? What should be done before making contact if it's an emergency or coming to a family member's aid?
I can take the first question, and one of the things that MCW does is we provide the medical oversight for the County of Milwaukee's EMS services. And so our university's done a lot of work with the county to ensure that a couple things happen. Number one, that adequate screening as part of the 911 call happens so that the first responders have a sense for whether the patient may actually be infected with COVID-19, but also putting into place policies around personal protective equipment for those first responders so that they are protected when they go into a home environment to assist the patient, but also using that PPE on transport to the various emergency departments in our community.
Boy, about the part about what do you do with your loved one when they're sick, that's really tough. I think, Ian, we're sending a lot of patients home that may have tested positive or suspected to have mild coronavirus infection. What advice would you give for people that live in the same home with them if they're self-quarantined?
Yeah, I think, and you mentioned some of these things in your opening remarks. I mean, I think, and I know this can be a challenge, but if it's a couple, for example, not sleeping in the same bed, not sharing the same bathroom, not sharing the same utensils and silverware, frequent hand washing, frequent cleaning down of doorknobs, door handles, faucets on sinks and tubs. Those are some of the things that you can do. I get it, it's extraordinarily difficult to do, but that vigilance in terms of cleanliness in the house is really, really important to helping other members in the household not get the infection.
Ruth's question goes, as a lab professional, do you have any information regarding test availability for hospital labs?
I can start. Freighted and really all of the major health systems in the region do have labs that can do different types of COVID-19 or coronavirus testing. The real problem is getting enough tests. Either we don't have the machines that we need or the ingredients that you need to do the test. And that's a limiting factor. I mean, there are others, but basically the most important problem for all of us right now is we just don't have the tools that we need to do those tests. We have the people that know how to do it, but we don't have the ingredients.
Good point.
Next question is from Jim. I have heard there was potential fear of this mutating and hitting us a second time.
Well, we always worry about that with a virus, especially a new one. But what we know so far is the virus can mutate, but it does it very slowly compared to other similar viruses. So even though that's a theoretical risk, and it's certainly possible, many experts don't believe that that's going to be a real problem for us. But we really won't know until we get through the next few months. If you think about the Spanish flu pandemic in 1918, there was a first wave in the spring, killed a lot of people. It went away in the summer and it came back in the fall, and it killed a lot more people. And then there was a third wave again in the spring, and then it was extinguished, and we really don't know what happened.
Next question's from from Gail. Is it true we should not take Advil or ibuprofen if we suspect we're infected?
Well, I'm glad we got that question. There's been a lot in social media about that, and you'll hear a theme here as many of our questions, or many of our responses start with, we don't have good data to say that that's the case. So as far as we know, you should not be making any changes to the medications that your primary care doctor has you on, unless he or she gives you specific direction that you should stop a medicine or add a medicine. And again, as far as we know, it is safe to take Tylenol and Motrin if you are struck with a fever, for example, or having body aches.
Sarah is asking, is there any evidence to suggest that with warmer weather, the virus would have a harder time spreading? Or is this just because people are not in close quarters indoors?
We just don't know. I think it's probably the right answer. We're all hoping that when warm weather comes, like many other viruses, that it'll dissipate or disappear, but I don't think any of us are counting on that.
Sorting through some of the repeat questions here so we can try and get through as many as we can. Just a heads up though, guys, we've got dozens of questions here yet tonight. So maybe if we don't get through them by 7 o'clock, I'll send the list over to your people, and maybe there's a follow-up strategy somehow with those. So keep asking, everybody. I'll try and sort through these, and I'll skip over some of the repeats. Tammy asks, so if there's no treatment or vaccine and one gets diagnosed, do they simply have to hope not to die? How do we know whether a diagnosis is terminal or not? Is it truly a flip of the coin?
So that's a great question. So what we do know is if about 80% of cases are folks who are either completely asymptomatic, meaning they don't know that they even have the infection because they're feeling well, or have very, very mild symptoms, probably like a run-of-the-mill cold. So we're really left with 15 to 20% of the patients who go on to develop more severe illness that sometimes requires hospitalization or even hospitalization in an intensive care unit. We do know that 15%, many times those patients are patients who are elderly, so over 60 years of age, or have other underlying what we call comorbid conditions, so diabetes and respiratory illness, various heart conditions. So that's why we put a lot of focus on testing those sort of patients, our eldest patients in our community, and those with comorbid conditions, because from what we know so far, that 15 to 20% who go on to develop severe illness usually are older members of our community.
Derek has two questions, but the first one's a little easier. Is it possible to get these graphics to share? And I'll just share with you that there's a panel in your control panel called handouts, and the PDF of this set of slides is available there for you to download during the session, and you'll also be sent a link after the session to get them. But Derek's real question was, should people not have intimate contact with their spouse if they suspect that they've been exposed?
Yes. Particularly if you're having symptoms of coronavirus, again, the cough, the fever, the shortness of breath, you certainly want to wear a mask to protect others. And again, going back to a lot of the things that we've talked about throughout the session, maintaining great hand hygiene, social distancing, so again, keeping yourself away from those who appear well, are important ways of making sure that you don't infect others.
Thomas asks, what is the evidence for how long the virus remains viable on surfaces? I've heard from 24 hours to 17 days.
I've heard ranges from a couple of hours to a few days, and there are many, many papers being published on that. But I think it's safe to say that we should be washing our hands. There are folks that if they get shipments of plastic wrapped items, that they wipe them down with a bleach cloth or spray with Lysol and wipe down just to do that disinfection. That's probably not a bad idea. But again, back to what Dr. Martin was saying about frequent cleaning of surfaces in your house that have contact with items and with your hands is probably the best thing you can do.
Desi's asking if there might be a mandate that happens where everyone is required to wear masks while outside or in public. How will masks be made available in the wake of the shortage?
I don't know if there's a mandate, but if somebody hands down a mandate, I hope they have a solution for how we can get masks.
Maria asks, is there a way to test if someone who was previously ill to check if he or she had the COVID-19 virus? Also, can you contract the virus again at a later time if you were tested positive? So some of those are coming back a second time.
Yeah, fair enough. We really don't know if you can get sick again. We hope not. There just isn't good evidence one way or another. We don't believe that you will be able to, but we don't know. As far as whether there's a good test, there are some new tests on the market that are just being rolled out that might help us determine whether somebody's had the infection and they're recuperating. But it's too early for us to really tell you how good those tests are. And again, one of the problems with these tests, especially because they're being rushed to market, is we don't know whether the tests cross-react with other similar viruses. So we don't want you to have had a cold and say that you have convalescent serum and you're okay, that you should go back to work. So that's one of the things that we just don't know.
I'm sorting through some of these guys so that I overlook the duplicates. What should folks do if they're experiencing symptoms but don't have health insurance?
Dr. Martin, you deal with this issue quite a bit.
Well, that's even when there isn't a pandemic, that's a really difficult question to answer. So I think the options at this point would really be to call the health department, who could probably assist patients in that situation. Of course, and despite the fact that I said, first call your primary physician or 211 and don't proceed directly to the emergency department, we're always here 24 hours a day, 365 days of the year if a patient feels like he or she absolutely needs to get emergency care. And we always see patients regardless of their ability to pay.
Mary Beth had a good question. Are there special risks for pregnant women or any suggestions that you have for pregnant women?
So you're going to see a theme here. As far as we know, there isn't any vertical transmission of the virus. And what I mean when I say that is the virus getting into the mother and then crossing over into the baby. We have no data to suggest that at this point. Having said that, most societies and most employers have moved to really try to limit the exposure of pregnant women to environments that are at increased risk. So, for example, in our clinical environment, we have made the schedule such that pregnant faculty, residents, staff don't have to work in the higher risk areas of our emergency department.
Great. One question that Erica had was about the location for drive-in testing clinics. Or do you have any information or advice on the drive-in testing availability?
There is a number, and maybe we can get it before we close, Freighter helpline number that will give you guidance about the various testing centers in the region. I don't have, my apologies, I don't have that right off the top of my head, but we can probably find that.
Mabel has several parts to a question that I haven't seen yet. We need answers to the following questions as it relates to COVID-19 virus and relates to residents in Sherman Park. Why is Sherman Park listed as a hotspot? What data is contributing to the hotspot designation? And has the City of Milwaukee Health Department, CDC, or other healthcare professionals explained to you why the COVID-19 virus is spreading through Sherman Park? And then the last part of that is the fact that St. Joseph Hospital is conducting COVID-19 testing contributing to Sherman Park's designation as a hotspot?
Well, those are all tough questions. To be designated as a hot zone or hot spot, you need to have a significant increase in the number of cases that you have. That would be maybe above what you'd expect for the background population. So here in Milwaukee, my understanding, and I think our health commissioner knows more about this because they've been doing the investigations. The first few cases that were in Sherman Park and nearby were from individuals that had traveled to an area that had high COVID-19 exposure, and that they may have brought that in from travel related. But I think it's also fair to say that it's too early for us to really be able to know. And in part, as we started out here, we're reaching out to you to see what we can learn as well. And Ian, I don't know if you have any connections to the health department that would be different or more enlightening.
That's much of what I've heard as well.
And I'm just repeating what I heard from health department officials on other teleconferences about what they're doing to try to find out why we're having this problem there. But what I also want to say is that it may have started there in Milwaukee. It's spreading. There's a hot zone on the near south side in the Latinx areas, and it's spreading throughout the suburbs and everywhere else. So it's going to be a problem for all of us in Milwaukee, no matter where we live.
Absolutely.
Richie had a question about church. What's the highest recommendation for the church? Should the churches shut down for a period of time altogether, or continue on with the social distance suggestion and gathering of no more than 10 people? There are mega churches that are not abiding by these recommendations, if so.
My personal suggestion would be that I think we all should be practicing social distancing. If you come to our campus now, we have very few people who are on, but we manage to keep operations going. And we do that through tools like we're using tonight for this town hall. So I would strongly urge our churches to look for other virtual options to bring congregations together, but to keep everybody safe.
Another question from Derek. Do we have to schedule an appointment to get tested, or can we just go to see any doctor?
So if you call it's primary care physician dependent. So if you call your primary care physician, he or she will give you guidance about how to go about getting a test through his or her office. If you're a part of the Freighter Health System and you call our hotline, they will give you guidance about a specific appointment at a specific center at which you can get a test.
How many affected people are in the hospitals right now, and are they managing patient load okay at this point? That's from Scott.
Dr. Raymond, you would take that one, or?
Well, obviously you know a lot more about the second part, but yes, we're managing the caseload, and every health system is doing well right now. So I think it's fair to say that, and we do speak frequently with each other. I just had a teleconference this morning about how each health system is doing. In terms of the numbers, they're published on the Milwaukee County Health Department website every day. We're up to over 600 cases here in Milwaukee County and almost 1,200 cases across the state. And as Dr. Martin said, 15 to 20% of those end up needing hospitalization at some point during their illness. And we're not overwhelmed right now. But again, we're seeing that doubling rate, maybe being every 3 to 4 days. And you can pile up the patients pretty quickly if you're doubling that quickly. So even though things are fine now, we are asking for everyone to do what they can to socially and physically distance so that we can avoid a surge that overwhelms the health systems.
Absolutely.
A very unique question from Kathleen. Should an RN receiving chemotherapy take herself out of the workforce at the patient bedside in lieu of risk for exposure?
I want to make sure I heard the question correctly. So should an RN who is undergoing chemotherapy remove herself from the clinical environment?
Yes, I think so. I'll read it again. Should an RN receiving chemotherapy take herself out of the workforce at the patient bedside in lieu of risk for exposure?
I think in the end, it's a personal decision, of course. Our practice and our clinical environment is that providers, healthcare workers who have special needs around this, who have they themselves either are older or have other pre-existing conditions like underlying cancers or getting chemotherapy or diabetes. Those are individual conversations with that particular health worker, and we have worked hard to try to accommodate safe working environments for those folks. So I would invite that person to have a conversation with his or her supervisor about other accommodations.
Scott asks, is there a percentage available of people tested that have COVID-19 positive results?
I'll start. It's running between 3 and 6% depending on the community. So it's fascinating that people that are coming in with what we would call a high index of suspicion, somebody that the doctor or other healthcare provider thinks could have the coronavirus infection, a lot of the tests are coming back negative. And Ian, you're on the front lines. Do you have any more insights?
Yeah, and I think that's just the function of, we know that the test does not pick up every patient who actually has the disease. So we see a fair number of false negatives in the order of about 30% or so. And so that's why we continue to recommend that even patients who have a negative test but have symptoms, that they do the self-quarantine, because we do acknowledge that the test doesn't catch every patient who actually is infected.
I think one of the other challenges right now is, at least for adults, even though it's tapering off, we're still in the flu season, and that can make it difficult to tell the difference between the two diseases. And kids too have the flu and respiratory syncytial virus around this time of year that can have similar symptoms.
Absolutely.
There's another pregnancy question, but this time from the husband, Anthony.
Eric, I think we lost you.
This is Jason Boyovich as a backup to Eric here. Let me pick up on that question that I think he was beginning to read from Anthony. It says, in addition, will spouses be banned from delivery rooms?
That's a great question. Most inpatient environments, most clinical environments have gone to a limited visitor policy. That's to protect the visitors from exposure to sick patients, spread of the virus, to protect the healthcare workers. So you'd have to call the individual facility for further guidance around that. But I wouldn't be surprised in the least bit if they tell you that visitors won't be allowed.
Got it. Let's move on to a question from Jim. Kind of a follow-up on the temperature question. Do any of the more temperate countries or regions give us clues about the disease dissipating as the temperature goes up? And I suspect that might have something to do with the summer, kind of the summer season coming upon us as well.
Very difficult question to answer. I know there's been a lot of attention focused on the Southern Hemisphere and the apparent, not lack, but not so much of penetration of the virus into communities. But I would say Australia and New Zealand have quite a bit. Southeast Asia had some cases as well. And I don't think that we can completely count on warm weather being our salvation. And we honestly aren't getting great information from many of the countries in South America and Africa right now. And I think it's a problem for us to make any conclusions.
Totally agree.
Got it. Well, thank you, doctors, for answering these questions. I think we got through as many as we possibly could. As we get to the top of the hour, we're going to pass it back to Cory Nettles to do any closing remarks and bring us home.
Thank you.
Thank you.
Great. Well, thank you all for joining us at our town hall conversation here this evening. Certainly the number of questions underscore the importance of us having this conversation as a community. We hope that you will keep listening in at MCW and at other trusted sources of information as we do everything that we can to keep our community safe. I certainly want to personally thank Doctors Raymond and Martin, who have so generously given of their time beyond their day jobs to responding to this community crisis and doing it in a way that is thoughtful and informed and calming. So thank you to both of you. We will continue to gather questions, and we will put together a frequently asked questions with answers, and we will push those out to you through the information or the portal that we use to confirm you all's participation here today. So please keep your eyes open for that. Additionally, we encourage you to go to the MCW Resource Center, and that website address is COVID-19, COVID-19.mcw.edu. At our resource center, you'll find answers to these frequently asked questions, but we're also going to post this conversation, this town hall, for your future use, and so that you may share it with others. So thank you again for joining us at this town hall. We certainly ask that you all stay safe yourselves and make sure that you're keeping your family members safe. Thank you and have a great evening.
Thank you.